Assalamu alaikum. In this video I discuss sphenoid bone. At first the anatomical position and points. This is the body of the sphenoid which lies centrally. This is lesser wing. This is greater wing which directed laterally. The superior surface of the greater wing of the sphenoid is deeply concave and pterygoid process is directed inferiorly. Now the description of the body of the sphenoid. This is superior surface. This is ethmoidal spine which connect with the cribriform plate of the ethmoid. This smooth part is known as the zugum sphenoidally, which laws gyrus recti and olfactory tract. This is chiasmatic sulcus, which laws optic chiasma and its connects to optic canal. Then a elevated area, this is known as the tuberculum sali, and the posterior limit of the tuberculum sali, there is a two elevation. This is known as the middle clinoid process. Then the deep depressed area, this is known as the sellaturcica. Deepest part of the sellaturcica is known as the hypophyseal fossa, which laws the pituitary gland. This is another elevation. This is known as the dorsum sali, and these two are the posterior clinoid process, which attach with the tentorium cerebelli. Now the posterior surface of the body of the sphenoid. The posterior surface of the body of the sphenoid is rough, which articulate with the basilar part of the occipital bone. Actually, this is the basilar part of the occipital bone. In case children, the posterior part of the body of the sphenoid is articulate with the basilar part of the occipital bone by a hyaline cartilage from a primary cartilaginous joint, which ossify at the age of 20 to 25 years. So here ossification is occur. So this is the basilar part of the occipital bone, and this part is known as the cleavage. Now the anterior and inferior surface of the body of the sphenoid. So this is the sphenoidal crest, which continue inferiorly as sphenoidal rostrum, and just lateral to the sphenoidal crest, this area is the sphenoidal concha. This is sphenoidal foramen, and this here filled cavity, small cavities, this is sphenoidal ear sinus. This sphenoidal ear sinus through the sphenoidal foramen is communicate with the sphenoethmoidal recess of superior meatus of the nasal cavity. So this is a sphenoidal concha, which is present in the anterior surface, on the anterior surface, and also in the inferior surface. And this is the vaginal process, which is present in the inferior surface of the body of the sphenoid. Now the greater wing of the sphenoid. Greater wing of the sphenoid has three surfaces. This is cerebral surface, which laws the temporal lobe of cerebrum. This is orbital area, and this is the lateral area. This is superior orbital fissure. The middle part of the superior orbital fissure, just behind, there is another foramen. This is foramen rotundum, and this is foramen ovale, and here foramen spinosum is broke. This is foramen ovale, and this is foramen spinosum. The superior orbital fissure is transmit the ophthalmic divisions of the trigeminal nerve, oculomotor nerve, trochlear nerve, abducens nerve. So 1 sensory and 3 motor nerve. Actually, the branches of the ophthalmic nerve are passed through this. You know the branches of the ophthalmic nerve: nasociliary, frontal and lacrimal. So trigeminal nerve has 3 branch: ophthalmic, maxillary, mandibular. So ophthalmic division of trigeminal nerve is passed through the superior orbital fissure. Through the foramen rotundum, maxillary division is passed, and through the foramen ovale, the mandibular division is passed. And the foramen spinosum is transmit middle meningeal artery, and you know the branch of the middle meningeal artery is the branch of maxillary artery, and maxillary artery is the branch of external carotid artery. So this is the orbital part of the greater vein of the sphenoid. It's from the posterior part of the lateral surface of the orbit, and its medial margin is from the superior orbital fissure, and its inferior margin is non-articular. It's from the inferior orbital fissure. It has 2 articular parts. This part is articulate with the orbital plate of the frontal bone, and this part is articulate with the zygomatic bone. This is the lateral surface. Is divided into a upper part and lower part by the crest, and this part is from the temporal fossa, and here temporalis muscle is attached, and this lower part is from the infratemporal fossa and is attached with the upper part of the lateral pterygoid muscle. Pterygoid process of the sphenoid bone. This is lateral pterygoid process. This is medial pterygoid process. The lateral pterygoid process, also known as the muscular plate, because both sides of lateral pterygoid process is attached with the muscle. This is the lateral part of the lateral pterygoid process, which attaches with the lower fiber of the lateral pterygoid muscle. This is the lateral surface of the greater vein of the sphenoid. By crest, it's divided into upper part, lower part, and this lower part of the lateral surface of the greater vein of the sphenoid and the lateral surface of the lateral pterygoid process from the infratemporal fossa, and here the upper part of the lateral pterygoid muscle is attached, and the lateral surface of the lateral pterygoid process is attached with the lower fiber of the lateral pterygoid muscle. This is the medial side of the lateral pterygoid process. Here attached the most of the fiber of the medial pterygoid muscle. So both sides of the lateral pterygoid process is attached with muscle. Lateral part is attached with the lateral pterygoid muscle, and medial part is attached with the medial pterygoid muscle. So this lateral pterygoid process and medial pterygoid process, in between there is a fissure. This is pterygoid fissure, and there is a depressed area. This is known as the pterygoid fossa. There is an oval depression. This is known as the scaphoid fossa. There is a foramen, pterygoid foramen, which transmit pterygoid nerve and vessels. Now the lesser wing of the sphenoid. This is cerebral surface. This is inferior surface. This is anterior border. This is posterior border. The smooth cerebral surface is related with the frontal lobe of the cerebrum. The inferior surface medially is originate superior oblique muscle and laterally levator palpebris superioris, and lesser wing form the boundary of the superior orbital fissure. This is anterior clinoid process, and it attaches with the tentorium cerebelli. So this is all about the optic canal. Optic canal, through the optic canal, optic nerve and ophthalmic artery is passed through. So this is all about sphenoid bone.